Lots more poison oak behind me. Hi folks, it's Switchback. This video is all about poison oak, and the information also transfers to poison ivy and poison sumac. Obviously the identification is a little different and the locations are a little bit different geographically, but I will also cover that briefly. How do you identify poison oak? Well, I have a whole bunch of it behind me here. So here's some here. Here's some over here growing up this tree like a vine, which is really common with poison oak. The saying is leaves of three, leave them be. The leaves can be red or green, and there may be no leaves in the wintertime and all you see are the vines, and those are just as poisonous as these bushy little plants right here. Here are some images of poison ivy for identification. These are images of poison sumac to help you identify it. Urushiol is an oil, and that is the substance that leads to an allergic reaction in 80 to 90% of people. And the people that are not currently allergic to it can always develop that allergy later in life, especially with multiple exposures. It's the same substance in poison oak, poison ivy, and poison sumac. Since it is an oil, it tends to stick well. So it sticks on animals. So imagine your dog that's been crawling through poison oak and then jumps in your sleeping bag with you. And it can stay on inanimate objects such as tools, clothing, gear, etc. for up to 5 years. Urushiol will trigger an immune response, and it looks like a rash that can appear within a few hours to a few days. You can have blisters that have a fluid that is not contagious. You may see bumps, swelling, streaking, and of course, itching. How do you prevent getting poison oak? Well, first of all, clean any gear that you've used outside with soap and lots of water or with rubbing alcohol. Be sure to wear gloves when you do this. Any clothing that might have been exposed needs to be washed in its own load with hot water and detergent. Barrier creams may provide some protection. Look for the ingredient bentoquatum, which is spelled right here. These creams should be washed off and reapplied twice daily. Avoid burning wood or sticks that may contain urushiol or may have the stems from poison oak, poison ivy, poison sumac, because then you have that oil in the air and it can be inhaled and cause a very severe allergic reaction. If you're getting any value out of this, be sure to like it below and hit that subscribe button. Moving on. If you think you might have been exposed, wash the area as soon as possible with soap and lots of water, or use rubbing alcohol. The sooner you can do this, the less intense your reaction will usually be. Wash gently so that you don't rub the oils into your skin. Wash under your nails when you're washing your hands with a brush. If you've got that lovely rash going on because you know you've been exposed, then you can try using some calamine lotion or hydrocortisone cream. Follow the directions on the package, but never apply them to open skin or open blisters. A wet compress may help, an oatmeal bath or oatmeal paste. Same thing with a baking soda bath. You can put a cup of water in the running water as you're drawing a bath, and lukewarm water usually feels best for the itch. Avoid scratching because then you can increase your risk for an infection. You can take an oral Benadryl, just be aware that of course it can make you tired. Do not apply a Benadryl cream. When should you go to the doctor? Well, if it's a severe case, if it's so itchy that you cannot sleep, if it's not improving within 7 to 10 days, or if it's on your genitals or face, then you should be seeking medical attention. Call 911 or go to the nearest emergency room if someone is having a severe allergic reaction with difficulty breathing, swelling, or a fever, or if they have a history of a severe case. I hope you found some value in this, and if you did, of course, give it a thumbs up below and hit that subscribe button. I will look forward to seeing you next time. Thank you so much for watching. Bye. You should seek a medical attention then. The skin. Or a warm comfort.